Good day, everyone. I'm Dr. Dada Rufus, a medical practitioner of over 2 decades in medical practice. I base majorly in public health. I work in the public health facility. And there is a topic that has been bothering my mind, and that is very rampant now. It is a chronic condition, emergency condition that has been affecting people. The name is called stroke. It is a an emergency condition that affects blood supply. The blood supply suddenly cut off, and so as a result of it, depriving the brain of the blood and the nutrient that it needs to survive. And so, how do we know that this feature affects? It cut across all age, can affect both young and old. And this condition is noticed through some significant signs like face becoming turning to another side. Also the arm and the leg, one of the leg, you might not be able to raise it in the client. Also, there is slurring of speech, or the person loses his ability to talk. So, or maybe the saliva is drooling from the mouth. Also, the person might even urinate on the body or passing stools that he cannot control. All those are the signs you watch out. There are other signs like headache or sudden loss of balance. And although some people, they don't present, when they present, the health practitioner may be able to pick high blood pressure. It might be high blood pressure that has been on the patient for a very long time. But because there was no adequate help on time, and so it becomes another thing. What are the two types of stroke? One is sudden blockage of the blood vessel, and the other one is bleeding stroke, which is called hemorrhagic stroke. And so all those episodes can be prevented and treated if the patient presents early. Or it is a usual practice now here that majority, immediately this thing happen, what do they give? They will think it's being caused by an attack, spiritual attack. It's being caused by the family attack. It's being caused by those people that did not like them. And so because of that, they will be seeking spiritual help, and or they will be giving palm oil. They put palm oil in the mouth of the patient. They give the person herbal concussion, thinking that is what will solve it. And the trick of the problem is that the moment you act fast by taking the patient to the health facility, the person can be recovered, brought back to the previous condition. And that is, you will have to recover without any complication. But the reverse is the case. So now, what am I going to tell people? It is to know the cause. The major leading cause of stroke is hypertension in this our environment. You see, hypertension, that is when there is rise in blood pressure. So also other things that are contributing factor to the stroke evolution is salt intake, excessive salt intake. This type of salt, some people, anytime they are eating, they have to get a small container on the table, put salt, and they will be sprinkling it on the food. Why? It has become a bad habit, and they are always used to it. Some people cannot even eat anything without having sugar. It is very common, very rampant. So what do we do? There are other things that can cause it when we are having sedentary habits. Sedentary habit, you always sit down, you don't do exercise, lack of exercise. When you are taking, you are a smoker, a chain smoker. When you smoke, it damages the blood vessel. And so because of that, the vessel that is supposed to be able to make there is blood flow smoothly, there will be sediment there, and so because of that, the lumen will reduce, and so there will be a predisposition to hypertension, and so all these things are causing problem to the clients. Also, there are other things that happen when somebody is too much obese. According to the body mass index, if somebody may be very obese, and so when you consider the weight and the height, and so because of that, we need to manage and bring the person weight back to normal. Stress can also be a cause of stroke. And now, how can we prevent stroke? We can prevent stroke by checking our blood pressure regularly, at least 3 to 6. In 3 to 6 months, you do it once. So, and if it is discovered to be high, medical practitioner will be able to place the person on antihypertensive. And so it will be well managed and will prevent the stroke that may come in place. Also, we reduce your salt intake. Let's be satisfied with the sweetness of the soup you are being given or the food you are being given. You don't need to add extra salt, because all this extra salt we are adding is like a poison. Also, we must exercise regularly. Let's make it a habit. Stop smoking. Stop smoking. They say smokers are liable to die young. Stop smoking. And also, we must reduce our alcohol consumption. When we do that, we are likely to live a healthy life. Control your sugar and cholesterol. So, when you do that, what will happen? Stroke will be highly prevented. Let's also avoid, whenever you see somebody who is already, you are noticing face deviating to another side, or the saliva drooling from the mouth, or maybe there is incontinence of any degree, do not give palm oil, do not give herbal concoction. What we need to do is to act fast by taking the person to a medical facility where you'll be able to get help. Also, when we do that, we will be able to save the life of that person and prevent the complication that may likely follow stroke, which is disability. In conclusion, stroke can kill, stroke can paralyze, and also it can destroy family income. And you see, when the family income is attacked, there are so many things that we may not be able to achieve. So it is better prevented and managed by controlling blood pressure, by also living a healthy lifestyle. And we must act fast whenever you see any patient that have all the features I mentioned above. Watch out for the next episode. My name is Dr. Dada. Watch out for the next episode. In case you want any other topic to be treated, feel free to comment. If you have any question as regards the topic I've just mentioned, feel free to comment and I will get back to you. Also, like, share the video to people that you know it will be of benefit to. Thank you.